So this is Dr. Ward, and I'm moving on to podcast number two. And in this podcast, I'm just going to be talking about, I said behavioral in the other podcast, but I meant biological and cultural context of psychiatric mental health and nursing. One of the things that would be very beneficial for you as students is to just kind of go back and review anatomy and physiology of the brain, because anything that is related to psychiatric mental health biologically has to do with the brain. So you got to know just the normal major parts and what their functions are: the frontal lobe, the occipital lobe, the thalamus, the midbrain, and kind of what the different areas of the brain relate to biologically and how they make our thoughts and our thought process work. So, how many of you are familiar with the Taylor Swift and Kanye West incident? Well, Taylor Smith and Kanye West were on an award show. And when you think about the award show and Kanye's behavior, it was completely inappropriate. I'm going to post the link on Blackboard, and I'd like you to watch that clip. Can you tell me biologically what you think was happening in his brain, or what were the biological implications that were a precedent to his behavior? So if you just kind of look at the clips that I post for you and see, you'll understand where I'm coming from or what I'm talking about. But I think it is truly an active example of how biologically our brains can be impacted by the things we do. Um, the other thing that we need to just talk about when you think about biological implications is I really want you all to remember or think about neurotransmitters. Basically, they're chemicals, they're stored in the brain, they're responsible for electrical impulses that tell our bodies what to do, how to act, how to feel. Basically, from an impulse, a neurotransmitter can be released, and when it does, it can combine with the receptor site that will determine kind of what our neurological response will be. It is really important that we understand neurotransmission, because typically treatment modalities and therapeutic interventions for people who have mental illness work by controlling neurotransmission in some way. And neurotransmission that is controlled can facilitate normal brain function. Um, when we think about neurotransmission and biologically how neurotransmission works, there are receptor sites and neurotransmission that occurs through certain pathways. So, what medications and some therapies will do is restructure those pathways through neurotransmission that are infected and that are altered. Also, if there's any damage in tissue, neurotransmission sometimes can facilitate the repair and sometimes medication of particular areas in the brain and the tissue therein. As nurses, we need to know and learn that we need to know and learn that there are symptoms, and we have to understand and become familiar with the symptoms, which is part of this course. We have to know biologically if there is a neurobiological process that causes a symptom to happen. We have to know the function of the different areas in the brain or the impact of pharmacology on neurotransmissions, because we're going to be given medications. Uh, our knowledge of neurobiological impact are helpful with identifying diagnosis and prepping patients for diagnostic tests. We can consult physicians on making sure that they select effective treatments for our patients. So basically, uh, neurobiological processes help us maximize positive effects and minimize unpositive effects of individuals with alterations in mental illness. So today we have a better picture of mental illness, and that's because we have so many neurological imaging techniques that really help us identify what are the functional or structural issues in the brain that may be related to the problem that an individual is having. This is a testing concept, and these are the most common neuro or brain imaging techniques that are used in diagnosing mental illness. They are number one, the EEG, the electroencephalography, the CT or computerized tomography, the MRI or the magnetic resonance imaging test, or what we call the position emission tomography or the PET test. So remember, brain imaging tests are performed to look at either structural, if there's something structurally wrong with the brain tissue itself, or if there's something functionally in regard to impulses and the way that the tissue is supposed to function. So the first test that we're going to talk about is the CT scan, but I just need you all to remember that don't ever forget the principle of simple to complex when diagnostics are concerned. Physicians are going to start with the most simple tests that are sensitive, meaning they're not evasive, they're simple to do, and they can just pick up something, and then they're going to, or the presence of something, and then they're going to go to a test that's a little bit more specific. It may be more invasive, but they're going to go to simple, then they're going to move to that complex test. So we're going to start talking about the CT scan. And the CT scan in mental illness is basically where they're just going to take those x-rays of the brain. And they are really good at looking at anatomical things, especially in anatomical differences in patients with disorders, because there is some difference in anatomical structure for people who have schizophrenia or organic mental disorder or bipolar disorder. But in these tests, you can actually see a difference. And then there's the EEG. The EEG is the electroencephalography test, and that is actually look at brain activity. The biggest thing about this is that they can use it to diagnose stroke or degenerative disease or some type of neoplasm. As a nurse, you always need to know a couple of things about an EEG. An EEG basically looks at activity, electrical activity, so it's really going to tell you more about function as opposed to a CT that's going to tell you about structure. People should not have caffeinated beverages prior to having this test because it could change the electrical wave patterns that it's measuring. And finally, they place the electrodes on the scalp, so you need to tell the patient that they won't be shocked or electrocuted, but they may have to wash their hair or get the glue or the paste removed from their scalp after they have the test. Now, the other one that's more anatomical is the MRI or the magnetic resonance imaging test. And during this test, they put the patient in the tube and they move them through, and radio waves kind of pass through a magnetic field around. It creates a 3D image of internal structures. So this tells us whether there are structural issues in the brain or not. And here again, like I said, you look at these specifically in individuals who have stuff like diagnoses of diseases like schizophrenia. So we've already talked, remember I said, don't forget structure, function, and the tests that do the different. These are testing concepts. We'll be reviewing these because you should have been introduced to these diagnostic tests already. The position emission tomography test, that's the PET test, and this is where you actually give the patient an IV, they get a radioactive substance, and the head is surrounded by detectors, and it's kind of going around, and it's measuring function like glucose, oxygen use, blood flow, neurotransmission. So this is another one that's looking more at the function as opposed to the structure. And they use these tests to really see, as I said before, what's going on in the brain. And you'll be able to see that when they do a PET scan on people, who have different disorders, for example, like depression, the images will show the difference between a healthy brain and a non-healthy brain. So these are really good. In schizophrenia, when they do these tests and they're looking at it, they can actually see a change in the ventricle sizes. So these are just some biological diagnostics and some concepts around biological implications of alterations in mental health. I just want to briefly talk about genetics and mental health. There is ongoing research. There's not a drop final decision. There's a lot of controversy on research in individuals with alterations in mental health. However, what's out there does say that there is a demonstration of familial tendencies and links to patients with mental health. They're saying that in twins, they've been able to see some differences in the brains with the twins when they looked at identical versus fraternal. They look at the degree of the relative to determine the possible incidence or likelihood of the development. It's a sensitive area, so the nurse should just kind of show or share with the nurse what the current evidence on genetics says, remind people that the information is growing and we can't be 100% sure, show regard for privacy and respect of their genetic lineage. And finally, you're not the genetic counselor, so encourage them to see a genetic counselor if necessary. Finally, in terms of the biological assessment, symptoms of psychiatric and neurological illness can overlap each other. So people who have a psychiatric mental health disorder can overlap with someone who has a stroke or a brain tumor. So assessment of symptoms is going to be very, very, very important. Um, People who have brain tumors removed or who have increased intracranial pressure often are aggressive and angry and fight. And this is also a sign of somebody who actually has an issue with mental illness. So just remember that there are some physical issues that can cause people to manifest with psychiatric disorders that we see, which are common. One of the assignments posted for you on Blackboard will be a matching, or you identify the diagnostic test. Diagnostic testing for mental illness is a testing concept and a key concept for your first exam. So please make sure that you use this podcast to support you. And now we have one final one: defense mechanisms.